Good afternoon, good evening, anyone according to the time zone you are watching us. Welcome to another Health Data Global Talk. And this time I'm interviewing Dipak Karla, president of the IHD, and also Alexandre Silva, which is the president of the Portuguese Multiple Sclerosis Society, the SPEM. It's really great to have you both here with us. And starting by alphabetical order, perhaps, Alexandre, could you please introduce yourself to the audience, and then Dipak will do the same briefly?
Thank you for having me in the show. It's very important for the patient associations to be involved. I'm a retired naval architect that decided to become a patient advocate 4 years ago, and now I'm doing it in a vocal way and in a very active way. For me, data is the key that will help us, the patients, to be more aware, and especially be more educated about our diseases and about the strategies to navigate the disease in terms of quality of life. So we believe that the power of data will give us maybe not the cure for the diseases, but at least will improve our quality of life. So that's my motivation, and that's my participation in this context, that I'm a believer. Thank you.
Thank you so much, Alexandre, and thank you for this kind introduction. Dipak, over to you.
Oh, thank you very much, Paul. So I'm the head of a European not-for-profit institute, the European Institute for Innovation through Health Data. Delighted to be working with you, Paul, in this conference that we're talking about. But personally, I was a family doctor in London in my early career, and I shifted into research, and in particular, research into electronic health records. And I've actually now reached maybe 30 years of history working in the field of electronic health records. Data has therefore been a critical part of my career, and I've seen how different stakeholders in the health and the research space critically need data to address our learning needs, our quality needs, our safety needs, including the kinds of example that Alexandre just spoke about.
Fantastic. I feel that it's going to be a very interesting interview right now, because we have two perspectives, patients and family doctor with a wealth of experience in AHR. So in your perspective, and now switching here the order, perhaps Dipak and then Alexandre, what does data quality means to you, Dipak, and why is it so important?
Well, the reason that data quality is so important is because we need to trust the data we're using. When we're looking at the care of an individual person, a patient, a clinician needs to know that they are looking at accurate data, up-to-date data, the complete data picture on a patient. When a patient is using their own data, they need to know they've got the full story. But the moment we want to learn from that data, to do research, to discover new knowledge, whether it's testing a drug in a new way or a brand new medicine completely, or it's an algorithm or artificial intelligence or a device, we have to know that we're making accurate interpretations of the data. If we don't know the quality of the data and we don't have high quality data, we will be inaccurate, unsafe, and we risk harming patients.
Absolutely. And how about you, Alexandre? What is your view on the importance of health data quality?
I think it's central. For me as an engineer, I have to have reliable data in order to make the proper decisions. If we don't have quality data, we will plan, or we will produce solutions for a very wrongful setting. So we need quality of data. We need that data be used in our favor in terms of patients. The Multiple Sclerosis International Federation has a program that is dealing exactly with this subject of the quality of data and how to harmonize all the data that already exists in data collections from several countries regarding the MS patients' trajectory during the disease. So it's longitudinal data. And the aim at the end of the day is that data can be useful for everybody. So it must we must attain a level of development in which everybody wins. So the payer wins, the researcher wins, and the people wins.
Thank you so much. And this is the last question in the show today, as we want to keep this brief for our viewers, not to going away. And the last question is, as you are going to make a contribution, and in this case for Dipak again, what is it that you would like, the main message for anyone to be, on your view, attending Porto for this summit that we are organizing, Dipak, and also the same for Alexandre afterwards?
Paul, the difficulty with data quality is that it's not an easy thing to solve. It requires many different stakeholders from many different perspectives to come together and to realize they are each holding a piece of a complicated jigsaw puzzle. Only when they fit together are we going to have the finances, the information systems, the training, the time and effort and the quality of data, the sharing of data, the interoperability, and then the uses of data by clinicians and patients. What we have done is brought together an amazing, high-profile but multi-stakeholder speaker collection to deliver through the conference. The speakers are coming excited not only to speak to an audience, but to learn from each other, because they know it's multi-stakeholder. I don't think, Paul, honestly, any conference has brought together such a diverse range of best of breed speakers right across our continent ever before on the subject of data quality. This is going to be a breathtaking event. You'd be crazy not to be there.
Thank you so much, Dipak. And Alexandre, I'm sure that you will also have many reasons to ask people not to miss this event in Porto.
Porto is a beautiful city, so if you want to be surprised by Porto, please join the conference. But the subject of the quality of data is paramount in all the discussion. So this is a very serious quest. This is a very, we hope, impacted event upon media, upon the governments, upon also the European Union. Because what we see as patients is that data is not being used in our favor. There are many interests on data, but many of them are conflicting. So we need to be able to sit on the table and harmonize our goals for the data. And if we manage to do that in a win-win-win the response, I think progress will arrive, and ideas like the one that now more than 40 national associations of multiple sclerosis, we just signed a pact to end MS, and data is crucial to end MS, and especially end MS consequences, because many of the 3 pathways that we choose are on the betterment of the quality of life of people that already developed MS. And so data is crucial for all of that, and data quality is paramount.
Fantastic. So thank you very much, Dipak and Alexandre, for this. If I may summarize, this is going to be the most comprehensive summit where multiple stakeholders will be addressing a very serious issue. And as Alexandre said, we have to have the consequences for this in terms of decision makers, politicians, and the whole of the European Union to pay more attention to the importance of health data quality as we are saving lives. Thank you so much, everybody. And that's all for today. Keep watching and following us for the next episodes of Health Data Global Talks. Bye for now.
Thank you very much, Paul. Thank you very much, Dipak.
Thank you, Paul.
And remember, time is brain. So let's do it the right thing.